My name is James Frederick Littles, radiation oncologist at Prisma Health. I grew up in Florence, South Carolina. I have a bachelor's degree in chemistry from South Carolina State University, medical school at Howard University, and did my training in metropolitan Detroit. Radiation oncology, quite simply, is using x-rays to treat cancer patients. There's a small subset of my patients have benign disease like keloids, but most of my patients are cancer patients. And I use radiation to treat cancer patients. I wanted to go into radiation oncology. My initial interest was in actually diagnostic radiology. My primary care doctor, who was, he was my hero. His son was a radiologist, and he introduced me to the field of radiology when I was a little boy. And actually, when I got to medical school, that field just didn't fit my extrovert personality. So I enjoyed the physics and the science of diagnostic radiology, and I looked at radiation oncology as kind of the best of both worlds, the physics and science of radiology with the direct patient contact. Well, I educate my patients first and foremost by spending time with them. When I see the initial consults, I make sure I set aside a significant amount of time to dispel rumors about radiation oncology myths. I recognize that I'm a stranger, so I want to do the things that I need to do to elevate comfort level. And one of those things is I create an environment where questions are fostered. And I'm very comfortable with questions. I'm very comfortable with second opinions. I take my time with patients, and I actually tell my patients that if they leave my office confused, then it's my issue. I haven't done my job as a cancer specialist. We care about each other, and we care about the patient. We create an environment where questions are fostered. We treat head and neck cancer, breast cancer, lung cancer, prostate cancer, lymphomas. I've treated several patients through the years with those malignancies. When I'm not at work, I have some interesting hobbies. One that a few people will surprise a few people is that I absolutely love helicopter tours. I've done several of them, across the country, and I just enjoy them, and it kind of fits my personality of somewhat instant gratifications. So if you'd like to have an appointment with me, have either your primary care doctor or your secondary care doctor, like your surgeon or your medical oncologist, make that appointment.